Professor Bassem Zarif, Professor of Cardiology from Egypt, and it's my pleasure to start the service of the Cath Lab at Coptic Hospital. Actually, the Cath Lab Hospital, the Cath Lab facility inside the hospital will offer a lot of services to the cardiac patients with the treatment of coronary blockage, whatever the acute heart attacks or the chronic blockage of coronary artery disease, and will service a lot of services for heartbeat abnormalities, whether implanting what we can call it cardiac pacemakers in case of decreasing heartbeats, or treating abnormal heartbeats. Also, we have a great service of a structural heart disease. If there is a congenital defects or holes inside the heart, or stenosis of the arteries, or complex congenital heart disease for the pediatric age group. And finally, we are treating and offering different facilities for the vessels, the veins of the lower limb, the arteries of the lower limb, the arteries of the neck, and any arteries even outside the heart. Actually, the service just started a few days, and we are in the kick-off. And actually, we have good news for the hypertensive patients. We are having some data about having some procedure to help the medicines to control your blood pressure. Actually, it's our pleasure to help the Kenyan peoples to find these facilities and this help for caring of their hearts, their vessels, and their hypertension, their varicose veins. Patients that came to the outpatient clinic complaining of chest pain and shortness of breath. Her ECG showed some mild change, and her heart pump was complaining of reduction of the power of the heart pump. So we are bringing her to the Cath Lab to see whether any blockage is responsible for deterioration of the pumping action of the heart, and to explain the ECG reflecting the electricity of the heart, that abnormalities that we found it on the ECG. We will have our journey inside the Cath Lab, and we have Our Lady today. It's a pleasure to have you in this journey to see everything from inside the Cath Lab.
I am a cardiologist in Coptic hospitals. We are launching our new Cath Lab unit in the Coptic hospital. We are doing right now all the cardiac procedure regarding coronary artery disease, regarding congenital heart disease, and regarding electrophysiology. We are serving all the patients with any abnormality in the heart. We are looking forward right now to make a screen for the patient with a varicose vein for free screening. Any patient that has any varicose vein, we are serving them, so we can do this screening for free, and we can do any procedure that we want. We are maybe in the next few days. As my professor said before, we are here to do all the coronary heart disease. We have clinic 5 days per week from 8 to 5 p.m. We are offering our all service for the heart regarding electrophysiology of the heart, congenital heart disease also. We have every week professors and consultants come from Egypt every week to cover all what we need. Of course, I am here 24/7 to serve any patient we need to do as elective procedure, and we are serving for emergency, as my colleague said. Any patients come with acute blockage and with heart attack or acute blockage of the vessels, we are ready to open it with the latest updated guidelines regarding medical or interventional.
We are launching multiple waves of missions to have different subspecialties in cardiology. We have a pediatric interventional cardiology dealing with all the cardiac defects that is congenitally transmitted, whether heart defects, hold inside the heart, stenosis in the great vessels, whatever, the pulmonary artery, the aorta or something like that. So structural heart disease for the pediatric age group and the structural heart disease for the elderly, like replacing cardiac valves, having some clipping for the other valves or dilatation of the stenotic valves. This will be on board, and I think very soon we'll have a group of AP, what we call electrophysiology of the heart, some experts that will deal with different heart rhythm abnormalities, whether bradycardia, we are going for a slow heart rate, for a higher heart rate, for abnormal heart rate, that's irregular heartbeats. So we are have expert in different fields of, and even subspecialty inside the cardiology. Important part that we are not only treating cardiac condition and the coronary arteries that is related to the heart, we are treating different vessels outside the heart, like the kidney vessels, like the lower limb vessels, the carotid vessels, and so even we have a solution for different diseases like hypertension. We have an ablation to the renal arteries that lowering the blood pressure down, besides the medications, not a replacing for medications that already use the patient, but sometimes in different scenarios we have a resistant hypertension that is not responding to treatment, so we will have a procedure that help the medicines to control the blood pressure of our patients. What is the currently available, and with the high-end machine of the Cath lab, and with other complementary facilities in the emergency room, in the department, in the coronary care unit, all together with a high-end expertise in the field, in different subspecialties of cardiology, whatever heart failure, heart attacks, coronary blockage, peripheral arterial blockage, treatment of hypertension, treatment of varicose veins. I think the full range of treatment that is available in the Coptic hospital will offer the Kenyan peoples a full service for heart and vessel treatment. I think whatever on the emergency level or on the elective level for the non-emergency part,